Hello, good evening. We'll briefly discuss itong retrograde urethrogram. Meron nagtanong kasi regarding this procedure and what does it mean in patients na napapagawa nito. If you're not all too familiar with this procedure, isa siyang special imaging procedure na ginagawa sa mga patients na merong pinagsususpetsyohang may paninikip sa daluyan ng ihi, sa urethra mismo. Wait, kukunin ko yung aking model. Okay. So, ito yun. For patients na merong suspected na okay. Ito yung bladder natin ng mga lalaki. Tapos going down is the urethra. Diyan dumadalo yung ihi ng patients. Okay? So, ang retrograde urethrogram, isa siyang X-ray procedure na ginagamitan ng X-ray kung saan magsushoot ng may buburay na magsushoot ng X-ray habang may nakapasok na instrumento tsaka nagbubuga ng dye papunta dito. Dye as in, dito. As in contrast. Tapos iilaw siya sa X-ray para malaman mo basically if you would be able to check the patency of this urethra. Okay? So there are other ways to do that. I mean, if you can insert a scope, you can visualize the urethra all the way into the bladder. Pero meron din ngang X-ray procedure wherein you put a small tube here, then push the contrast in and check the patency of the urethra itself. So it's special imaging procedure siya na ginagamit ng urologists, especially reconstructive urologists who treat urethral strictures. So I'll just show you some images na that may help you understand what a retrograde urethrogram is. Okay? And dito muna tayo. So, yun yung X-ray. So, eto, nakikita nyo to. Yan. So, makikita naman ninyo, no? This is the penis. Dito yung testicles, scrotum. Ito yung bladder, pantog. Ito yung dadaluyan ng dye at ng ihi from inside going outside. So kung maglalagay ka ng dye, dapat medyo maging ganito yung itsura ng mo mismo, ng X-ray mo. Pero white kasi nga X-ray yung gagamitin. Okay? Dapat patent yan. Merong pagluwag dito sa bulbar urethra, tapos may konting paninikip dito sa membranous urethra, and prostatic urethra, makikita mo yung verumontanum din, para yung hump So it will reflect also dun sa urethrogram mo. And the prostatic urethra, dahil nakikita nyo, prostatic urethra, dahil syempre nakikita nyo may prostate may dadaanan na medyo mas masikip na part. So you would expect somehow thinning sa area na yan. Okay? May makikita kang pagnipis sa area na yan na makikita mo rin sa mismong urethrogram. So, let's just see another image here. So, para siyang ganyan ginagawa. Ha? Medyo kakaiba siya pag ginagawa, di ba? Hindi naman ganyan ang X-ray lagi. Ang X-ray shoot lang. Pero ito kasi, meron kang ipapasok na material dun mismo sa penis. Yan. Tapos, bobombahan mo ng contrast. Okay? Ano, contrast media. Yun yung pag in-X-ray mo yung contrast media, it will light up sa X-ray. Then, i-interpret mo ng radiologist at ng urologist yung makikitang image. Okay? So, ganyan siya. Bubugahan ng contrast, susundan all the way up. Nakita mo, di ba? Parang maluwag dito, medyo sisikip dito. So, sa dami ng normal na urethrograms na nakikita ng radiologist and urologist. So we can distinguish somehow kung merong problema yung daluyan ng ihi. Tulad ng sinabi ko, most of the time, this is performed when there is a suspected stricture in sa urethra going into the bladder. Okay? Lahat yan may image yan. Okay? So, I'll show you some images. Okay. This is from Radiopedia. Normal retrograde urethrogram. Yung itsura, tulad ng sinabi ko, di ba? Yan, oh. Nakita nyo? Ito yung anterior urethra. Tapos posterior urethra. Dito yung bulbar urethra, medyo lalaki sa area na to. Parang bulb, di ba? Bulbous. Tapos, ito yung verumontanum, yung sinasabi kong parang hump. Kita ba yun dito? Hindi masyado kita dito. Tapos, dito yung prostatic urethra. Yan. Yung sa area na to. Sa area na yan, ito yun. Yan yun. Tapos, bladder. Iilaw. Yan yung contrast. Ha? Kaya pag in-x-ray kayo with contrast, or sinitis ka kayo with contrast, basically, pinakamadaling i-describe yung contrast na pampailaw ng x-ray. Okay, so this one, ayan, ito yung verumontanum. Dito yan banda sa tapat ng prostate. Okay? Wait 1 minute. Okay. So, yun yung normal prostatic, membranous, bulbar, and penile urethra. Penile urethra sa bandang dito. Membranous, bulbomembranous urethra dito yun. Prostatic urethra, ito. Okay, so ito may annotation siya. Yan. Ito, again, penile urethra, bulbar urethra, membranous urethra, verumontanum, prostatic urethra. And this is the urinary bladder. Yan yung expected na makikita mo sa normal na retrograde urethrogram. So another image, ito, meron ka makikitang stricture. Ayun, zoom in. See? Ito yung bulbar urethra, di ba? Bulbar, kung ikukumpara mo dito, yan yung bulbar urethra na normal. Ano natin? Compare natin. Yan yung normal. Tapos, nakabaliktad lang Ito, nakikita nyo? Meron biglang paninikip. Yan. Ibig sabihin may pangangapal dito. Yan yung tinatawag na stricture. Yan yung tinatawag na urethral stricture. And that has to be treated. And right now, it's really a surgical matter kapag meron kang urethral stricture na ganyan. Inooperahan yan. Sa tight bulbar urethral stricture. So, ang bulbar, dapat ganyan, no? Diba? Siya yung parang malaki, pabilog. Pero dito, meron siyang paninikip. Okay. Yan yung trabaho ng retrograde urethrogram. Tapos, in other cases, may tinatawag na bladder neck contracture. Ang area ng bladder neck, ito. This is the bladder neck. Contracture ka, parang sarado siya. Para siyang sarado. Ganyan. Masikip na masikip dito. Ayan, no? Bladder neck contracture. Ito, ano to? VCUG ata to. Yan, tama. Voiding cystourethrogram. Okay. Kinuna naman yan. In-x-ray naman yan habang umiihi yung patient. Pero nung kinorek, ayun, obliterated, sarado na. Pero nung kinorek, nung inoperahan na after repair, tingnan nyo, di ba? Parang may embudo na dyan. Maluwag na siya. Compared dun sa taas na masikip na masikip. Okay. So, there are several reasons for an abnormal retrograde urethrogram. Tulad nito, pwedeng stricture. Pwede rin kapag yung contrast ay hindi tumuloy sa urinary bladder. Isipin nyo, diba? Just think of it logically. Kapag naglagay ka ng dye from here, going up, tapos hindi tumuloy sa pantog, there are several reasons. One of the most na isususpect mo na condition is merong paninigip or stricture like this. Ha? Sometimes, kung hindi maganda yung pagka-push, medyo mahina yung pagka-push ng contrast at malaki yung prostate, hindi rin tutuloy papuntang pantog yung contrast. Okay? Pero ang pinakahinahanap mo naman talaga kapag nag-RUG ka is urethral stricture. If depende sa symptoms, interpretation, imaging, and sometimes we also conduct this imaging with scope. So parang ano yun pwede ka mag-retrograde urethrogram and also perform urethroskopy. Ibig sabihin, meron ka ng camera na ipapasok dito mismo sa daluyan ng ihe. Okay? And once you find out what the cause is ng problem with your investigation, then you will know what to address kapag you will know what to address kapag nakita mo na sa RUG or sa urethroscopy yung problem. Kung stricture, opera mo yung stricture. Pag malaki yung prostate, then you can perform surgery on the prostate. Depende rin yon kung nakaihi pa yung patient o hindi na. So, options for the prostate, you can perform laser prostatectomy, TURP, or open. Pero one of the leading options nga, like what I'm saying always, is laser prostatectomy because it has shorter catheterization time, less bleeding, and shorter hospital stay. Yun. For urethral strictures, depende sa type of stricture, length ng stricture, kung gagamit ba ng graft or hindi. Maraming iba-ibang technique. It's a little complex and it's a highly specialized surgery performed by urologists and most especially by reconstructive urologists. Okay? So I hope somehow I got to explain sa patients na nagtatanong about retrograde urethrogram or RUG. It's an overview of what this procedure is, what it does, how it is interpreted. Pero next time, we'll go more in-depth sa discussion nito alongside urethral strictures or prostate enlargement. Okay? If you have any more relevant questions, you can just post your questions here or message me directly on any of my platforms. Alright? Ako po si Doc Drew, urologist. Thanks for watching.